Hi, my name is Martin Doyle. I'm a physiotherapist, and this is Tim, one of my patients. And Tim, how long have you been a patient of ours at the clinic?
Around about 10 years.
10 years. And what sort of musculoskeletal conditions do you have?
I've had a couple of problems over the years. I've had an operation on my knee some years ago, and also an operation on my shoulder.
Mm-hmm. And what operation did you have on your knee?
It was a meniscal tear
Mm-hmm.
in the right knee, and that was repaired by a surgeon some years ago.
Mm-hmm. And the shoulder?
The shoulder was a little bit more complicated. There was an acromion spur.
Mm-hmm.
I had a bicep tendon rejoined, and I also had a rotator cuff cleaned up as well at the same time.
Mm. And I think they reattached your rotator cuff as well.
I think they might have, yeah.
Yeah, so that was quite extensive surgery. You had about three procedures.
Yes.
The biceps was reattached further down, the acromion was shaved back, the rotator cuff was reattached. So that's quite amazing surgery. And your rehabilitation, has it gone well?
It went very well, in part because I trained up pretty heavily beforehand to build the strength up in my shoulder.
The rotator cuffs, yeah.
And I actually bounced out of the other side of the operation very quickly.
Yeah, okay.
The surgeon was very, very pleased with how quickly I recovered from it.
And in fact, some of the research done on the BioThermaRed was done on shoulder surgeries, was done on people with frozen shoulder and with capsulitis. And so having a shoulder who's gone through that surgery is a really good structure to utilize the BioThermaRed for pain management and increasing blood flow to the area.
Yeah.
Now, you already use the BioThermaRed on certain parts of your body, is that right?
I do. So, my philosophy has been to try and maintain a regular exercise routine to help maintain what I've got, particularly as I'm getting older.
Yeah.
I think the more you can keep moving as you're getting older, the greatest service you do for yourself. But occasionally, things will go awry.
Mm-hmm.
You might get a little bit of pain from a bit of over-exercise or just day-to-day activities.
Mm-hmm.
And I find that the BioThermaRed then gives very good relief when you need a good warmth over a particular part of the body.
And you can see with Tim's right knee, it doesn't fully straighten. And again, that's a classical sign of someone with some wear and tear in the knee joint, and you can see the muscles a little bit more wasted in this side than that side. And that's why if Tim does overdo it from an exercise point of view, if he exercises too hard and gets muscle soreness or the joints get a bit flared, then the product that Tim's got is the 960, which is the heavy duty one, and Tim uses it like in this position at home, and so that goes across both knees. And I think the temperature you set it at 60, is that right?
Yeah, about 60
And how
degrees.
long do you have it on for?
Usually about 25 to 30 minutes.
25 to 30 minutes. Okay, so that's and he also uses this on his shoulders and back, which I'll show you later on. But this is a nice adjunct. If I was treating Tim, I could put this on before we started the treatment, and then for maybe 15 minutes, and then I could remove that to the side, and then I could start some of my manual therapy techniques to help maintain the range of motion and make sure that Tim doesn't lose any more range, because that's the thing with osteoarthritis. If you start losing the range of motion in the joint, you lose the muscle power and strength, and then the process just progresses. So it's an indictment on Tim. Is it that the right word? I think the fact that Tim exercises so much is quite important, that he's able to maintain this. Now, what I'd like to do is to turn you over, please. Just put them there. Just put it there, Tim. Now, remember that Tim also, just lift your legs up, Tim. Tim also suffers from a bit of wear and tear in his lower back, and this is where this product comes in really handy. And Tim uses it like this at home. We can put that straight across there, set it on about 60 or 65 degrees, depending on the condition and what the patient's preference for heat is. Remember, the manufacturers like a bit of weight on the product because they want the infrared heat to penetrate. Remember, it's the moist cover here. The moisture gets absorbed through the cover from the atmosphere. It's only a small amount of moisture, and then that penetrates through the skin into the muscle, into the areas where we need to increase blood flow and oxygen and remove away the toxic structure there to facilitate sort of healing. So Tim also has a chronic neck problem. He just had some recent x-rays. He had some loss of movement in the neck. And so you could also use the product further up, either preferably without this structure on. We could move this up here, and that would be lovely for his neck as well. So it can be used on the lumbar spine, and it can be used in this sort of position. And Tim will show us shortly how he uses this at home on the couch. So remember, lumbar spine it can be used for, thoracic spine, and the cervical spine. There is a smaller version of this that you could use for smaller sized people or ladies or elderly sort of patients. But this is a nice position. I find in the clinic I treat people a lot with the Biothermal Red before I do my manual therapy. I can also use it on if there's DOM, soreness on the legs, I can also move the product down here. Again, I use a lower temperature on the legs because the skin is a bit more sensitive. And for Tim, when he does come in for treatment, I'll either mobilize the spine and put this on, or mobilize the neck and finish with some heat in those sort of areas. Okay, thank you. Okay, and remember Tim's shoulder, he's had extensive shoulder surgery with all those conditions. And I just wanted to show you how I use the Biothermal Red as part of my treatment. So I find this position is a really nice position for the patient because we've got the pillow, it's comfortable. Remember, these sort of surgeries are quite sore. They're in a sling for 6 weeks, and then we're guided by the surgeon with regards to the rehabilitation that we use. So we treat it quite conservatively, but once we start moving, it's nice to get a bit of warmth into that shoulder for pain management. Remember, the moist infrared heat, it can help with the healing by increasing blood flow and oxygen to those damaged and repaired areas, and also helping take any waste products away. So I find the neck and shoulder, if you're a clinician, they're quite nice because they fit over the shoulder really quite nicely. And then you can also give the patient you can set the time and the temperature, but you can also give it to the patient as well. So with an extension lead, you can move that around that way, and they can be in control of the temperature. So as a clinician, you would set the time, you would set the temperature. If the patient was at home, they could use the product in the same sort of position. They could set their own time and they could set their own temperature. Just remember, if you're in an aged care facility or nursing home, then as a clinician, the safety aspects of this is that you can set the temperature, you can set the time. It has a lock-in facility that can't be changed. If the patient touches any of these dials, it won't change. And then if you use it again, it'll stay on those parameters that you used before. But for the shoulder and the neck pain on that side, I find this product and this position quite comfortable to use. So what I'll do is I'll ask Tim just to demonstrate how he uses his 960 product at home on the couch for his pain management. Thank you.